Thank you for choosing to view this webinar, which is a product of the TEAM study. TEAM stands for Transition Education in Autism, and the purpose of this specific webinar is to help guide families and caregivers of children and adolescents with autism through the transition of healthcare from pediatric to adult care. In this webinar, we are going to focus on the following topics. Transition. What exactly is transition and the transition process? Why is transition planning important? When and where should this occur? Self-advocacy. What is self-advocacy and what does it mean to be a self-advocate? How can we help our children with autism become effective self-advocates? Health issues specific to adolescent health, including safety, sexuality, and mental health. We will discuss how to bring up these difficult topics with your child and introduce a few strategies on how to discuss these topics. Making the transition to adult health care, including what steps you and your child can take to look for an adult health care provider. What legal issues could you encounter during the transition process? We will give a brief explanation of terms and choices, including guardianship and alternatives to guardianship, and what steps you can start taking today. Let's begin. What is transition? Transition is the change from one stage to another, such as the transition from the stage of adolescence to the stage of adulthood. Transition does not occur at one single point in time, but over a period of time. It is a process. Why is it important to plan for a healthcare transition? Growth, development, and change are inevitable. Many pediatricians and pediatric specialists are unable to see children past young adulthood, so the transition from pediatric to adult care is inevitable for most people as they grow older. We need to anticipate and plan for the process of transition. Traditionally, adolescence is a time of intense mental, physical, social, and emotional growth, especially complex for children with autism spectrum disorder due to their unique healthcare needs. This process is difficult for most people. It involves meeting new people, forming new relationships, and establishing trust. Planning for a transition can make this process more manageable. The earlier the planning starts, the easier it can be. When should you start planning for a transition? Start at the beginning. Start thinking about transition at the time of diagnosis. Whether your child is 2 or 12 or 22, it is never too early to start. Where do we start planning for transition? Start with your child. His or her needs, hopes, goals, and dreams should drive the transition process. Some individuals with autism can verbally communicate their thoughts. If so, these conversations should serve as starting points to develop their transition plans. Transition planning is not just one single conversation. Some individuals may not be developmentally ready to tackle the process or not be able to communicate their needs due to limited communication skills. This is particularly challenging for families and may require more time to understand what their child's goals are. The transition process will take time. It is important to work with your child to provide the self-help and self-advocacy skills that he or she needs in order to be an active participant in the process and keep the goals relevant to your individual child. One teenager said, "I have had several experiences with many doctors talking to family and staff about my health issues before talking to me. This individual wanted to be involved in his own health care. When preparing for the transition process, it would have been important for his family and his physicians to include him in talks about his own health issues. Again, we need to start with the child. But in addition, to the extent possible, it is important for our children to learn to advocate for themselves. For most of your child's life, you have probably been advocating for your child, which means making decisions for him or her. However, as individuals age, they will need to be able to advocate for themselves to the best of their ability. Helping adolescents with autism to develop a sense of self will aid in the transition process and will develop a skill that can benefit them throughout their lives. What is self-advocacy? Self-advocacy is speaking up for yourself, asking for what you need, negotiating or working with others to reach an agreement that will meet your needs, knowing your rights and responsibilities, using the resources that are available to you, and being able to explain your unique circumstances by the use of written words, pictures, or gestures. It is never too early to begin to teach self-advocacy skills. It is a process and it will take time to acquire these skills. One way to teach skills is to have your child make their own choices, such as choosing what to eat, what to do for fun, and what chores to do around the house. You can also help your child learn self-advocacy by having them choose the timing of events, like when to get up, when to go to bed, and when to eat a meal. Finally, another way to teach self-advocacy is to have your child make personal choices, such as what to wear, what to eat, and who to be friends with. When applying self-advocacy skills to the healthcare transition process, you can have your child choose when to take their medications, at the same time helping them understand what medications to take and why they are taking them. Your child can also begin to make their own healthcare appointments, initially with your assistance. Another way to use self-advocacy in the healthcare transition process is by having your child track their own personal healthcare issues. Self-advocacy is an important skill. A child can become an even better self-advocate if they have a better understanding of the health issues they will face. As Sir Francis Bacon said, knowledge is power. Sexuality, safety, and mental health are all issues that many adolescents face, including adolescents with autism spectrum disorder. Discussing issues with your child is not an easy task, but it is a very important one. You are probably in the best position to educate your child. Whether you are comfortable or not, many parents and guardians feel that they would rather their child receive factual information from them than from a classmate or friend. But keep in mind that your child's physician can always provide support and be your backup. Important points to know are that you should start early. Many providers recommend starting talks about sensitive topics at the age of 10 years, or at least 2 or 3 years before puberty. Starting early can ease the process, especially for a child that has difficulty with change in general. Be clear and direct. Many adolescents pick up skills and knowledge indirectly from social cues, peers, or media. Individuals with autism may not pick up the same information as easily, which can lead to a large gap in knowledge and understanding. It is important to be direct in order to close this gap. Promote, encourage, and emphasize appropriate behavior. stop and redirect any inappropriate behavior, or maybe offer an alternative. You can help make the process more easy to understand by using resources such as visual schedules, checklists, videos, or pictures. This is an example of one type of visual resource. Sometimes it's helpful to break down a skill or behavior into a series of developmental sequences or events. For example, when talking about relationships or dating, we could break down the process for a child with autism by explaining to them in terms of smaller time points, such as first girl and boy meet. Then they talk as friends. Then they spend more time together. They may go to the movies or do another activity together. Then they may hold hands, and they may go on a date. This visual roadmap can continue all the way to marriage and family if it's applicable. When discussing relationships, it's important to address sexuality. But one important point is that sexuality education is more than just education about sex. Sexuality education is arguably more important for individuals with autism because they are less likely to learn from other sources such as peers or the media. Sexuality education can involve discussion about physical changes and personal hygiene. It is important for adolescents to understand what is happening to their bodies and what will happen in the future. Sexuality education also involves the concept of private versus public. This can include private versus public body parts, places, activities, or behaviors. The concept of private versus public is important in personal safety, such as what is good touching versus bad touching, and who to tell when bad touching occurs. Another important adolescent health issue is education about safety. About 50% of adolescents with autism spectrum disorder have wandered off at some point in time. Therefore, it's important to discuss where there are safe places, who are trusted persons, and for an individual to have a basic knowledge of their home phone, address, or contact information for guardians, how to use 911, or how to ask for help. Unintentional injuries are the leading cause of death and disability for all children and teenagers in the United States. Therefore, it is important to discuss driving safety if this is applicable, and even water safety. Finally, other topics that should be addressed in education about safety include social media use and even substance use. Mental health issues are also very common and very important adolescent health issues. Unfortunately, psychiatric disorders can complicate the transition process. Adolescence is already a time of change and stress, but a teenager with a mental health illness may have a more difficult time managing his or her emotions. This is further complicated because certain times it is assumed that behaviors and emotions are due to autism spectrum disorder, but this may not necessarily be the case. The most common psychiatric diagnoses affecting individuals with autism include anxiety, depression, and obsessive-compulsive disorder. If you suspect that your child may be suffering from a mental health issue, please talk with his or her primary care physician. They may conduct a screening with a written questionnaire and may refer your child to a specialist. As an overview of the webinar so far, we have discussed the importance of the transition process, self-advocacy, and adolescent healthcare issues. Next, we will discuss the actual transition from pediatric to adult healthcare. As children mature, pediatricians are no longer appropriate as their primary care physicians. Adults have different medical conditions and medical needs that a pediatrician may not have the expertise to address. It may be challenging to find a PCP that accepts their insurance and, more importantly, understands the unique needs of a young adult with autism. How do you start looking for an adult provider for your child? Start early. It is definitely okay to doctor shop until you find the right fit for your child. Your child should feel comfortable with a new physician before starting any checkups. If your child sees multiple providers, it may be beneficial to transition only one provider at a time, so that there is at least one person familiar with your child at all times. Is there one provider that is the most valuable person on your team? Then they should probably be the last person that you transition from. Sometimes the timing of transition will depend on a provider's area of interest. For example, a child neurologist may continue seeing a child until they are 21 or even 26 years old, while a pediatrician may stop seeing a child at the age of 18 or 21 years. Where do you start the transition process? You can start by asking your child's pediatrician for some names of primary care physicians in the area. If available, a family practitioner or a provider trained in both medicine and pediatrics might be appropriate given their additional training in pediatrics. These providers could also be good sources in regards to subspecialists. Once you have found a provider that you would like to transition to, it is important for there to be direct and clear communication between the providers. A written medical summary is the most common type of communication used between providers. Many providers who are familiar with the transition process will provide this for their patients. However, sometimes this is something that needs to be asked for. Please do not hesitate to ask your child's provider or remind them to write a detailed medical summary for the new chosen provider. A fact sheet about your child's specific health issues should also be asked for. And remember, always keep a copy of these documents for your own records. Finding a new provider for your child is an important step. But as we have demonstrated so far, healthcare transition is more than just picking a new doctor. Next, we will discuss legal issues that may surround the healthcare transition process. The age of majority in Pennsylvania is 18 years. This age is state dependent, but it means that parents no longer have legal rights in regards to their child's care, including accessing their confidential health and school records. According to the law, even a person with a significant developmental, cognitive, or mental health disability is legally permitted to make his or her own decisions once at the age of majority. In order to deal with this issue, many times families apply for guardianship. So what is guardianship? Guardianship is a court-ordered arrangement in which one person is given legal authority to make decisions on behalf of another person, such as their child, that has been deemed incapacitated by the court. Areas of decision-making authority are specified by the court. When obtaining guardianship, a lawyer is not required, but may be helpful to some families. There are various areas of guardianship. One type is a limited guardian. This is a person that makes decisions in only some specific areas, such as just medical care. This type of guardian may be appropriate for a person that can make some decisions on his or her own. Another type of guardian is a general guardian. This person has more broad control and more broad decision-making authority. This is appropriate for a young adult that has a significant intellectual disability and as a result is unable to meaningfully participate in important decisions affecting him or her. Finally, another type is a conservator. A conservator manages finances but has no authority over personal decisions, such as medical or educational decisions. So how do you decide if guardianship is necessary? Fortunately, legal guardianship is not all or nothing. You should consider each area individually when determining how much authority you need to retain and how much independence your child should retain. Some areas of consideration or questions to ask would be, for example, in the medical field, can your child seek medical care when sick or injured? Weigh the risks or benefits of a proposed procedure. Understand the needs for routine care. Assess medication needs and side effects. In the financial area, can your child understand money basics, including how to count money, the purpose of money, how to make change, how to safeguard money, and budget money? If you feel that your child is unable to do this, maybe someone like a conservator would be a good option for your family. In the legal area, would your child understand the implication of signing a document and be able to make sound decisions in important areas? In the area of self-care, does your child have personal safety skills, such as knowing not to wander off or not to talk to strangers? Know how to summon help in case of an emergency? Know basic safety skills, such as being careful around fires, stoves, and other dangerous objects? If not, your child may require a more general guardian. Other areas to think about would be areas of education and housing or living arrangements. There are alternatives to guardianship as well. Even if your child needs help in one or more of the areas that were discussed earlier, you can consider if he or she can be assisted by other means. A healthcare agent is someone that can assist with medical decisions only. A representative payee is someone who can assist with SSI payments. It's possible that your child may only need one of these persons rather than a guardian. The legal system can be difficult to navigate. So what can you do today to help yourself prepare for this part of the process? First, you can think about writing a letter of intent. A letter of intent is a document written by a parent or guardian that describes your child's history, their current status, what you hope for him or her in the future. This document can be used by any person helping to care for your child in the event that you become ill or disabled. It is best to involve your child to the extent possible so it truly represents your child. A letter of intent is not a legal document, but courts and others can rely upon it for guidance. It is best to start one as soon as possible and then update it as years go by. Also, you can consider consulting with the experts, such as a family law attorney, a financial planner, or others prior to your child reaching the age of majority. You can discuss other financial matters with them, such as a special needs trust and support programs through the Social Security Administration. This brings us to the end of the webinar. To review, transition can be a difficult time for everyone involved. The process should be person-centered. Start early. Healthcare transition should include promoting self-advocacy, focusing on adolescent-specific issues, finding an adult healthcare provider, and determining if guardianship or alternatives to guardianship are needed. The topic of transition is a large and complex one, and this webinar serves only as an introduction into this process as it applies to healthcare. Next, I will provide you with a list of valuable resources that you can refer to for more information and guidance as you continue to navigate the transition process. These resources will be sent to you in an email as well. This brings us to the end of our presentation. Thank you very much for your time and your support. I hope this webinar was helpful for you and your family. For further questions or comments, you can reach the team at transitionwebinar@gmail.com.